Information from this video is not to dispense medical advice nor prescribe the use of information as a form of treatment for medical problems. Please always consult with your physician or medical team on questions you have.
Hi, my name is Judy Macias Harris. I'm a certified speech-language pathologist and instructor of the kinesiotapy method. As a speech-language pathologist, it's my job to know the working of the human mouth. Like us all, in these harrowing times of COVID-19, I've had to deal with a lot of things outside my control. Nonetheless, I've been trying to do those things in my control to protect my family and myself. There are, in fact, some simple, common practices that you can do to promote a strong immune system. And one of these is to maintain good oral cavity health. So thank you for taking some time to hear me mention prevention.
So why the mouth? For 3 reasons: gateway, bacteria, and opportunity. What do I mean by gateway? The biggest entry for bacteria to enter a person is through the mouth. It's the largest cavity of our body, and it's always open for business. Your mouth is itself a direct gateway to your lungs. Since bacteria harbors in the mouth and digestive tract, bacteria can enter the airway through regurgitation or when we have problems with swallowing function. This is typically known as aspiration. As you can see, oral health and immune system functioning are closely linked. Think of your immune system as your armed forces. Every day, all day, your immune system troops are hard at work fighting off pathogens like bacteria and viruses. It's important to note that not all bacteria is bad. In fact, for optimal health, bacteria, good and bad, need to be in balance. It's not good to have too much of one over the other. The second reason to focus on oral health is bacteria. Did you know your mouth has ecosystems? An ecosystem is a community of living organisms. In the mouth, there are 5 major ones for good and bad bacteria to exist: on the tongue, in the cheeks, teeth, above and below the gum line, and in saliva. When your immune system troops are strong, the good bacteria can keep the bad bacteria under control. It can also ward off viruses. This is important because viruses need a helper to thrive. That helper is the bad bacteria. Bad bacteria can colonize in these ecosystems when oral cavity conditions are not optimal. That just means when the oral cavity is not moist or hydrated, the tongue is coated, gums are swollen, red or bleeding, teeth are missing, and tartar debris are present. The third reason to focus on oral health is opportunity. When you get sick, your immune system troops are weakened. Because they are still trying to ward off bacteria, they may not be strong enough to ward off bacteria and an invading virus. So if the oral cavity has optimal conditions for bad bacteria and your immune system is weakened, then a virus has a better chance of entering the nose or mouth than the throat. Once there, it has a chance to move toward the lungs. So let's mention prevention, as there are some common sense practices you can do to keep your oral cavity in optimum health. Number 1, brush and floss your teeth. Number 2, stay hydrated. Number 3, reduce the amount of refined sugars consumed in foods. Number 4, consume foods that have some crunch to it, preferably fruits and vegetables. This can help break off the plaque on the teeth and gum line. It can also help promote chewing and tongue movement.
I hope you found this information useful. Our next series will cover products that I like to use that help promote good oral cavity health. In the meantime, please be safe and stay well.